afternoon. I'm Tom Gresnigt. I'm a Dutch tropical medicine doctor, or almost finished at least. I run Consult Online with my colleague Luke and Daphne, who are sitting over here. The three of us. It's an online platform to connect Dutch tropical medicine doctors in the field, in rural district hospitals, with specialists here in the Netherlands, who they can consult for cases they don't know how to handle, because you will meet your boundaries pretty easily. Internet is spreading, of course, here in the Western world, but also in Africa. Actually, when I was working in Rio de Janeiro, there was earlier Wi-Fi in the slums in Rio de Janeiro than in my city, Gresnigt, where I was studying. Consult Online is a platform, so it's actually a tool. We're not specialists; we're the one who are actually using it, and we facilitate for doctors they can consult. So it's a digital consulting system for the Dutch tropical medicine doctors. We started about 6 years ago. There are 50 specialists working in 20 specializations who the tropical medicine doctors can consult for questions. Our aim is to enable the tropical medicine doctors to receive relevant and applicable advice from specialists usable in their setup. So most of the 50 specialists are all tropical medicine doctors and speakers you've heard already this morning, or actually here in the auditorium. How does it work? We have our website. It's from our fraternity from tropical medicine. It's this website. It's in Dutch. We have our tool here on the homepage, which you can click on. Then you go to a field. You can select the email addresses from all the specializations. There are 20. So you choose ENT or pediatrics, gynecology, or surgery, whatever you need consultation for. Through the years, as said, we started in 2008. By now we're in 2014. We've been gradually growing. This year is not the best year yet, but of course it's not finished. We don't know yet why there's a decline, but we keep on bringing it under the attention. The top 5 of consultations are mainly dermatology, surgery, second place. Dermatology mainly because it's easy. You can easily take pictures of whatever you see, and the training in dermatology is a bit suboptimal. So it's an ideal specialization to send consultations, and everybody's quite quick, I have to say. Within 24 hours there's an answer usually, and in general within 48 hours you have answer on your questions. This is 2013-14. Consultations are from doctors all over the world, from speakers. We've met the one from Mexico, mainly from Africa, but also Asia, Indonesia, Nepal. So it's quite widespread. We publish also some of our cases 4 times a year in the Medicus Tropicus, and monthly a case in our newsletter from the fraternity, from the residents. I want to get through some cases to give a bit of an idea how this works. This is a case from Sierra Leone. It was a female patient, 25 years. She had a swelling of her knee since 4 months. She previously broke this leg after her fall, and at the moment she cannot stand at her right leg, and she has a 2-month-old baby. So actually, when they started, she was pregnant. Examination, it's not warm, it's tender on palpation, there's no pus at aspiration, and the movement of the knee is limited, and there are no inguinal lymph nodes. Any suggestions what we could think about at the moment?
Malignancy?
Maybe when we see the X-ray. The Dutch tropical medicine doctor was confronted with this case. What should I do? Could this be a cyst? Could it be tuberculosis? So she consulted the doctors back home. There's already angulation, so there's probably pathological fracture here. The advice was that most likely is an osteosarcoma, and the suggestion was an above-knee amputation for this patient. The follow-up, what we always ask with Consult Online, if the one who sends the consult, if they can also give the follow-up of the patient for the surgeons and also for the one who are reading it, what actually happened with the patient. She refused getting operated and went to the traditional healer. Later on, it got worse, even though she went to the traditional healer, and several months later she came. and she did get her above knee amputation. This, I think, is a 2-year-old case, so what happened afterwards, I don't know. But this is a couple months later. Another case from Congo, one of the successors of our chair, Matthijs. She sent this case, a 7-year-old boy. He had a mass in the cheek. It was from unknown duration, and he was suffering pain and fever. Any suggestions? This boy is in front of you. Already here a bit. Burkitt's lymphoma. The advice was from the specialist that will most likely be a Burkitt's lymphoma. It's the lymphoma belt. It's more or less where there's about 50 centimeters of rain, tropical regions. It's most common. Also relation with EBV. The advice was to put her on cyclophosphamide, 40 milligrams per kilo IV, every 2 to 3 weeks for 6 doses. That was not available in the hospital. And then another specialist, or actually Matthijs, who was our chair here, he worked in this hospital before, and he had the contact details of the pathologist in the capital to confirm diagnosis and where to order the cyclophosphamide. So he gave the advice to his successor. The follow-up was that the parents took the child the night after the consultation out of the hospital to the traditional healer, which is similar as the one before. And he only once reappeared, received a blood transfusion for his anemia, and the day after he disappeared once more and never came back. Another case from Tanzania, from Halim Hospital. A 7-year-old girl, power of the leg since birth, no recent trauma. 1 year ago, fractured the tibia, was able to walk just a few meters. Further normal development, relatively short stature, but no mental retardation. And we see anterior bending of both lower legs. Left lower leg bended about 90 degrees, the one which was fractured, and the right one 20 degrees. There were no other abnormalities. This is how it looked, and the X-ray below. Any suggestions? Osteogenesis? Could be.
Osteogenesis imperfecta.
What's the options?
Congenital bowing.
This is more X-rays, the bone is still from good structure. The differential diagnosis the specialist gave congenital syphilis, Paget disease, as mentioned, osteogenesis imperfecta, fluorosis, rickets, or Weisman-Netter syndrome. The advice was that the malformations seem to be isolated and not progressive, and hence exact diagnosis had not the first priority, and an operation would be difficult but inevitable. So there were several options mentioned by the orthopedic surgeons, the trauma surgeons, like wedge osteotomies of the tibia and the fibula, external fixation, internal fixations by either K-wires, rush pins, Steinman pins, and there was one visiting orthopedic surgeon in Tanzania at that moment who went to that hospital afterwards, and he suggested multiple osteotomies and intermedullary fixation, also mentioned like a shish kebab technique. The outcome, what happened, a written letter for the school which explained the condition since she wasn't allowed to go to school with this condition. And they wrote the letter, and the father said they were happy with her the way she is, and she's happy too. So, no surgery. So, I think there were about 65 emails, and no surgery performed. Case 4, and the last one. 35-year-old female, HIV status unknown, and since 4 weeks she had a growing lump in her right breast. No pain, no pulmonary complaints. Tuberculosis, yeah. Breast cancer. Looks like this. Quite a big mass. So I went to the specialist. Obviously, the tropical medicine doctor didn't have a complete clue what to do with this. The advice was to diagnose would be dermatofibrosarcoma protuberans. It's malignancy from the skin, and he suggested an extensive local excision till the fascia, and the same tempi, a meshed split skin graft. So they started the operation, but during the operation there was pus coming out. They decided not to do a mesh graft directly, but with a primary closure, although they knew it was most likely sutures were going to fail, and put a drain. This is how it looked after 1 week. So I've got secondary fairly late.